Hi YouTube, this is Katie. Welcome to the next episode of the Moyamoya Diaries. Today is January 10th, 2014, and I am very proud to announce that it has been 1 year since my left craniotomy to treat my Moyamoya disease. So this is a big cause for celebration. I can't believe it's been an entire 365 days since all the drama and craziness and everything that went on last year with my surgery. It's been an entire year since then. Can't believe it. So I wanted to do a update video to let you know how everything is going since my last video, which was in May of last year. So in my last video, I talked about how I was going to be starting physician assistant school, and I did. I started in June of last year, and probably part of the reason you haven't heard from me since May is because physician assistant school is very busy and very stressful and crazy, and I'm studying all the time. And if I'm not studying, I feel bad that I'm not studying, or I am doing homework kind of things, or I'm with my study group doing whatever. It's crazy. It's very, very busy being in PA school. So I wanted to do a video though at the 1 year mark since my surgery. So I'm taking the night off. So I really enjoy PA school and I've been doing well. I've been making A's and B's in all of my classes, and right now I'm in the middle of a winter mini-mester that's like 3-4 weeks long, and I'm taking 2 classes, and knock on wood, everything's going really well so far. So that's been consuming my life for pretty much the past 7 months, 8 months. And in terms of my surgery and my Moyamoya disease, things have just been getting better every day. I do still feel symptoms, but nothing like I did before the surgery. If you saw my May video, I more or less said the same thing. I really only have symptoms, like really recognizable symptoms, once a month, maybe twice on the outside. They're very superficial feelings. My previous videos, I talked about my major symptoms, which were kind of numbness and tingling and muscle weakness on the right side of my body. And for the past X number of months, I mean 6-7 months, the feelings have only been in my hand, really. Beforehand, like even before the surgery, it would be on my face, my leg, my entire arm, my back. I would have like patches of my back go numb. It was very strange, but really for the past many months, it's just been confined to my hand, and it's very superficial, and the feelings don't last more than a minute tops. If they last more than a minute, then it's kind of like, oh, this is different, but that's all that's been going on. And I haven't been getting headaches the way that I used to before the surgery. You'd think that I'd be taking, ibuprofen for headaches all the time now that I'm in PA school, but believe it or not, I'm not really taking headache medication much. And then, the jury's still out on whether migraines are a Moyamoya symptom or not, but if they are, I've only had 1 migraine since my surgery. It was a few weeks ago. Was it? It was December. It was right after Christmas, I think, if I remember correctly. But it wasn't a bad migraine. It didn't knock me out. It happened in the evening. I had the visual aura that some people have when they have a migraine headache. And then I did have the pain, but it wasn't nearly what I've experienced before, especially before my surgery. So I'm really excited about all of this. So I really think that, I know that my surgery is not a cure and that it's not 100%, but I really think that it was a success, because I have definitely noticed the difference between how I was before the surgery and how I am now. So that's really exciting to see. In terms of in the near future, I will be seeing my neurosurgeon beginning of February for a 1-year follow-up. And I do need to see, I need to get a new neurovascular neurologist, not a surgeon, but just the neurologist. because the doctor that ultimately diagnosed me with Moyamoya disease has since retired, so I need to find a new guy. But I do still have my surgeon to see. And, I'll probably have to have some kind of imaging done to check up on the progress of the surgery, see if the surgery really did what it was supposed to do, making new blood vessels. So, I might have to have a CTA or an MRA. I'm really hoping I won't have to have an angiogram this year, but if I have to, then I have to. It's no big deal. I've had it done before now, and so I know what to expect. And they do need to monitor the right side of my brain, because when I had the angiogram in 2012, before I was even diagnosed with Moyamoya disease, they did see one area of narrowing on the right side of my brain. So the Moyamoya is present there. So far, I haven't gotten any symptoms on the left side of my body, so that's a good sign. But the Moyamoya is there, and it will have to be monitored. So it's okay, though. You know what I mean? I know what to expect. I know what the symptoms feel like. I'm, kind of educated in this now that I've gone through everything. So, if I have to go through everything again with the right side of my brain, no big deal. You know what I mean? Because I know now what's going on, what's happening, everything like that. So things are really looking up. I'm really happy to be where I am right now, 1 year from my surgery. So I wanted to thank everybody who's watched my videos and who's commented or sent me messages. It really means a lot to me to see that I've, reached out to people and you've gotten my message, and you have, I guess, taken a little bit of comfort in seeing that someone else out there is going through the same thing. So if you're out there and you've been diagnosed with Moyamoya disease, or someone you love has been diagnosed with Moyamoya disease, it's going to be okay. Take what I say with a grain of salt, because I'm one person, but I have gone through it from the diagnosis to the surgery and past the surgery, and it's really going to be okay. You're not alone. Your loved one is not alone. Moyamoya disease is treatable, and probably the reason that you've never heard of Moyamoya disease until now is because it's something that you're diagnosed with, you have the surgery to treat it, and then everything's okay. You know what I mean? Again, it's not a cure, but it really does help with the symptoms and help with restoring the blood flow to your brain. So please understand, again, you're not alone. Your loved one's not alone, and that Moyamoya disease is something that together we can all tackle. Okay? So thank you again, all of you, for watching my videos and commenting. Please feel free to leave me a comment or to send me a message. I'd be happy to hear from you. And thumbs up. Things are going really well 1 year from the surgery. Thank you again, and I'll talk to you later. Bye-bye.